one or two questions. In the event that I'm just feeling that the pumpkin is going to, that the carrot's going to turn into a pumpkin, then I can leave and you won't feel like I left something unsaid. Any questions or comments? Yes, sir.
Yeah, Michael, I got so excited last year. The medical profession actually gets it. And my question is there a contact point where those of us who want to support and work with the medical community, is that in place now, or are we still at the formative stages?
I would say it's at the formative stages. I think Michael would agree, but I think there's tremendous opportunity. In the Affordable Care Act law, there's some language about community-based preventive services. There's language in there about clinical preventive services. It's not so much what we're interested in, but there is a group of people that are looking at the evidence that exists around what are the kinds of things that we ought to do, and I think that's a tremendous opportunity to bring some folks together and say, here's a body of knowledge that exists. How do we work together to get to where we need to get it? And I'm committed to thinking about how to go beyond the formative stages and beginning to get doctors to think about accountable health as opposed to accountable care, and think more about what the outcome is, which is the healthier patient, rather than how much money gets into your pocket. That's too often that is what drives things. Yes, ma'am.
This is kind of maybe a follow-up question. So what's the best way to work with Kaiser Permanente, Blue Cross Blue Shield? Is there some kind of an umbrella group, or is it individual one-on-one? You just go to one of them?
That's an excellent question, and I think that you've got to think about this at multiple levels. Is there a national organization? I think you're going to have to back your way into it as you think about, for example, there's a framework being created for a prevention and health promotion plan for the nation. Be sure that as an organization you're engaged in that. At the state level, to the degree to which you can get the state parks and wildlife talking to health, that's another place to get things going. But again, that's formative. And at the local level, it's going to be really individual. There may be health plans that are all over these kind of opportunities and others that are not. And you begin talking to folks and see if you can find some like-minded people. I know that the the network that's being created, at least in Texas, is going to create collaboratives that one can draw some unusual or non-traditional players to the table and say, hey, this is of interest to you because the health, if it's about health, if you're interested in health, this should be of something that you would be interested in at least understanding is going on in your community. Derek, you get the last question, and I apologize, I really do.
Do you do much with employer counseling to help them develop wellness programs for their employees as a way for cost containment? And how could we be part of that so we can encourage the outdoors to be part of that?
I think that's another great question. You know, when I was, a little aside, when I was Commissioner of Health and I spoke with elected officials, one of the instructions you get is never tell an elected official that it's a good question, because if an elected official asks it, they believe it's always a good question. So, but that's a really good question. So I'll leave it there. You guys, the laugh says you thought about it a little bit. And clearly your BlackBerry or whatever it is working at the same pace as everyone else's. You've seen the commercials, I'm sure. I think that there's tremendous opportunity, and one of the things that I've been saying in the childhood obesity world is we've kind of figured out the policy issues, we've kind of figured out the evidence base, we've kind of figured out that this is a real issue. We've got some policies in place. You got Let's Move. I would say figure out how you become a part of the Let's Move movement. That's really important. But one challenge has been, how do you engage the business community? So I do think that those of you who are kind of activist types, go visit with your Chamber of Commerce and talk about, and actually as an organization you begin to formulate what are the talking points here. The talking points are we can attract business. The more stuff there is for the workforce to do, the more business comes along. There is the health gains that come from doing those things. There is the environmental, if you're an environmental activist type, there's the gains that come from thinking about parks and recreation, and they're all tied. You can tie it back to what Chambers of Commerce want to do. Two things at the Chamber of Commerce in Dallas. Their two goals are, one, to increase the prosperity of this area, and two, to draw more businesses down here. Those are two kind of separate goals. I believe the outdoors can fit into those two things very, very easily, because prosperity is often measured by one's ability to do these things that sometimes folks describe as the great outdoors. And if you can build that capacity, then this equity issue that I talked about with young people who maybe don't think about going hiking, they can be exposed to those opportunities as well, and it can be a win-win. So thank y'all. Okay, one more and then I'm leaving. I'm sorry. I'm going to leave, actually.
So reaction to it.
What's that?
Every year, the Pew Charitable Trust do a survey of the most reputable professions in America. Top of that list every year comes nurses, number 2, physicians, number 3, pharmacists. You have, in other words, in our communities, incredible credibility. So when you become a spokesman for this stuff, it resonates. We have a vested interest. It does not resonate to anything like the degree when you put it forward. So my question is, how do we get more physicians to be our spokespeople on these kinds of issues, rather than just occasional folks like you and Dr. Sue?
Well, I think I'm going to go back to what I said earlier. We've got to figure out collectively how we change the conversation from accountable care organization to accountable health organization. And there's people out there who in a variety of ways are moving in that direction. There's a guy named Ken Thorpe who's published in sort of the health policy world, and he's thinking about things called community health teams. There's a guy out there who's developed what's called the chronic care model, Ed Wagner, which talks about how important community is. And we've got to figure out collectively, and I'm more than happy to sort of engage in that conversation. It's absolutely what I believe. I believe the built environment and policy is what can drive health. To expect, I'm somebody who believes people have to take some ownership for how they live their lives. But we can take some societal responsibility to create the kinds of environments where it is easier to do the things we're saying people ought to do. If you say people ought to be physically active, but they live in places where they feel like they can't go outside, not possible. If you say you ought to eat healthy, but you don't even know how food grows in the ground, and that's a whole other thing that we can address in the great outdoors, is just even how food grows and your relationship to that, then it becomes difficult to expect that people will make good choices. I think that there's a growing public health community, no doubt, that is beginning to embrace that, and that includes all 3 professions, at least 2 of the 3 professions you mentioned, physicians and nurses. And I think, again, like I said before, this is the beginning, and I'm here to say, I know that there's others who feel the way I do. We've just got to figure out how we change the language, and I heard that terminology from Michael as well. Let's change it to accountable health organizations and not be excluded from the conversation, but say, we need to be at this table. We contribute to good health. Not just more prescriptions for more people. That, you already fell off the cliff. And one of my slides I use often is Humpty Dumpty. If Humpty Dumpty falls off the wall, we lost. We want Humpty Dumpty to stay on top of the wall, and I think we can do that. And again, so the challenge to me and Michael is, how do we take your challenge and move it forward? And I'll just say I'm willing to take on part of that challenge in the worlds that I operate already, and to continue delivering this message forward. I thank you very much, Cinderella.